So we're going to get started. A few housekeeping items. This presentation is eligible for 1 hour of CE credit. Please be sure to sign in to the sign in sheet. It's going around, but I'll leave it in the back. So if you don't get to sign in before, it'll be in the back so you can sign in on your way out. We will have a 10-minute question and answer session at the end of the presentation. For anyone joining online, please enter your questions in the chat. I will be monitoring them in the back of the room. So today we have Dr. Amir Ali presenting on artificial intelligence in healthcare and pharmacy practice. Dr. Amir Ali is a board-certified hematology oncology clinical pharmacist at the University of Southern California Norris Comprehensive Cancer Center. Amir received his PharmD at USSF and completed his PGY-1 residency at Kaiser Permanente, Orange County. He then went on to complete his PGY-2 oncology hematology residency at USC. Amir currently practices BMT cellular therapies at USC Norris. He also serves as the residency program director. His research publications and presentations span topics of hematology, oncology, BMT, and ID. He is the primary investigator on 5 phase 4 studies with grants totaling over $500,000. He has received awards as 40 under 40 in cancer, ASTCT New Practitioner, Project of the Year, and Professor of the Year at the USC Mann School of Pharmacy. So without further ado.
Perfect. Thank you very much. All right. Well, first wanted to thank you all for joining for this lunch session today. Feel free to eat throughout. I know you're all hungry and have a lot of stuff going on in the afternoon. Also wanted to thank the folks on Zoom for joining us today as well. Right off the bat, one of the things that you might be wondering is why is this oncology pharmacist giving a lecture about AI in healthcare and pharmacy practice? So just a little bit of background. That was a very exhaustive introduction. Thank you for that. It's always awkward just hearing. But I will tell you, I did not always start my career in pharmacy. That was not always my goal. In fact, I started my undergraduate training in computer science and started a tech startup when I was in high school and undergraduate in my education. So I switched gears, as you can tell, but my roots do stem in computer science. And I will tell you, my role has evolved over the past few years here at USC. So I've been fortunate enough to be exposed in many different practice settings, including inpatient care, ambulatory, clinic, academia, research, billing. So I've been really able to have a great understanding of the dynamics of healthcare from my point of view, but it certainly assisted me in understanding how artificial intelligence can play a tremendous role in our healthcare system. Let's see. All right, so disclosures. I will just share with you, nothing specific to disclose for this session, but I will share that I have used a mixture of ChatGPT, Gemini Plus, as I've created this presentation for you all today. So here are the objectives. It's not going to be a long presentation. I'm going to keep my eye out on the time as well, since our time is limited. But we're going to start off discussing really the role, the background of AI. What is AI? And a lot of us have a great experience of using these products, but do we really understand how it works? And I think a fundamental understanding of that is very important. Then we'll explore the impacts that AI can have in healthcare, pharmacy practice. We'll talk about AI ethics, which is always a fun topic. And lastly, we'll talk about vendor evaluation. There's countless companies. It's a huge money market right now in terms of new vendors coming out with their products. And we'll talk about how to identify strong products out there. So we'll go ahead and get started. So a little bit background here, and this is probably one of the few slides that I'll just read off the bat in terms of understanding what AI is at its core. So it's a science of creating systems capable of tasks that typically require human intelligence. Another way to put it, creating systems that require human intelligence is very similar. But there's these formal definitions that are in place for artificial intelligence. And it's actually, there's nothing new here. AI has been used in healthcare since the 1970s. In fact, Stanford has been a huge hub for AI use in healthcare. And for the most part, a lot of our use has been mostly research, development, and not really been deployed to the general public. But you fast forward to 2023, that was when ChatGPT was rolled out to everyone, made publicly available. And since then, there has been a huge boom in interest, even though a lot of these developments took place late 2010s, early 2020s, but really that paved the way in the excitement to where we're at today. I'll share a little bit about that bottom bullet point there. So now you can see about over 220 FDA approved or cleared options in healthcare, AI models that are being used in clinical practice. So this is just the start. I expect to see much more of these approvals coming soon. So whether we know it or not, AI has been in our lives for quite some time, as we mentioned. And one of the forms of artificial intelligence that we often talk about is machine learning. The concepts of a computer or a machine identifying patterns in different forms, right? Predictive modeling that occurs in healthcare. So you look at this example, this is one example out of many where you're having a machine that's predicting what is the next word that you will be putting in, or what's the next number you're going to be putting in on an Excel sheet. And certainly we've gone a lot more than that. So here are some of the applications of artificial intelligence. A lot of us are very familiar with the natural language processing systems, large language models. Those are kind of our chat bots, and I'll be focusing on that in the beginning of the presentation today. Many different options out there. We'll talk about vision as well. And vision in AI terms is essentially, the image generation, video generation that you're very familiar with, and reading images. So, one of the big topics we have right now is AI encroaching into radiology. You look at, for example, breast imaging, and we'll have that example later on, and how accurate it is to detect subtle differences in mammogram results that a human eye cannot tell, right? But an AI can. You'll see in robotics and vehicles, certainly a lot of us are familiar with that as well. Recommendation systems, right? A lot of us are very familiar with TikTok, Facebook, all these things where essentially when a video is uploaded, an AI will review that video and try to drag certain key characteristics from it and recommend it to someone else based on their interests. These are similar to algorithms, but a little bit more advanced. And lastly, healthcare. And it's estimated about 10 to 20% of users of AI are using it for healthcare already. So how many of you have used it already, whether you're on rotations or personal care, used it to ask medical questions already, right? I think not everyone's comfortable sharing that, but I'm sure a majority of us certainly have. And so one of the things I want to certainly touch upon is how artificial intelligence works at its core. And so has anyone wondered what GPT stands for? You'll see it right here. Generative Pre-trained Transformer, right? And what does the generative portion means? Creates new text rather than just pulling existing models out there. Pre-trained, meaning that we are training these systems with specific information, right? And I'll share a little bit about that on the next slide. Whether it's Google searches, clinical guidelines, you're giving it information that you're considering it to be the truth of what's out there, and letting it kind of learn from what's going on in those kind of search engines. And transformer, neural network architectures, right? This is really what makes AI so expensive, is building these structures in place, neural networks to come up with recommendations. So basically, I do want to share this point. AI, when you're using large language models, they're not thinking, right? It's all predictive analyses that is going on. So one example that I can come up with that is probably the most easy way to explain artificial intelligence is this example on the very bottom over here. So what you're doing is predicting the next word in the sentence. And you have over here to the example, the cat sat on the blank, and you give that to the AI and you see what it comes up with. What the artificial intelligence does, these large language models do, is break up these words into what we call tokens. And it tries to see sources out there that would make sense of what that next word will be. It'll come up with different options and kind of filter through these neural networks to come up with the best predictive answer to this sentence, for example. And you'll notice AI sometimes on ChatGPT, it'll say, give you two answers and it'll say, which one do you think is more accurate or which one makes more sense? And so it learns from the mistakes that it's making, right? And so obviously in this case, the cat saw on the mat more likely than coming up with spaceship, because it'll probably not find spaceship and cat in the same sentence as often in a lot of online public resources. So, this is just a visual of what's going on here. And so we are building these AI models, and they're all built a little bit different on what information it's trained with. For example, ChatGPT is not trained on guidelines. Those are, for the most part, private, non-open access material. It's trained on, open search engine, Google searches, what you find on Google that is not restricted in terms of access, right? So we do have to keep that in mind, and that's going to be a very important concept when we talk about it in the future. There are artificial intelligence systems that are trained on guidelines, though, because they license that information to them. So you're training these algorithms, and us as users, we're inputting data. The algorithm is coming up with a decision on what it thinks is the most predictable answer, or the most, an answer that makes sense using the algorithm, and then coming out with the data. And what we often say in AI terms is AI is like a mirror. It's what we put in. If we put in bad data and train these systems incorrectly, it's going to come out with that form of bad data as well. And so I know there's a lot of excitement with chatbots, and a lot of us think, it is actually one of the main forms of AI out there that is easily accessible to everyone here. But I do want to share some of the differences between existing chatbots and artificial intelligence. So currently, what we were seeing before the advent of these new chatbots is often rule-based chatbots. So example, I was dealing with this the other day. I'm calling Delta, trying to change something. And it's, the chat is looking for key specific words. If you don't have that word in there, it's not going to know what you're talking about. It's not going to direct you appropriately. So it's these decision trees that come down. And I will tell you, oftentimes we confuse chatbots, the rule-based chatbots, with forms of AI. These are very different. And a form of this is called, regression models, linear regression models, which are forms of mathematical equations that give you an answer. So a lot of people are actually branding their products as AI, even though it's not using these AI principles. So I just want to differentiate that fact. You'll see the difference here with AI chatbots, very different. These are the products that are trained on databases. They take much more complex queries. They learn from past interactions from users and are able to evolve over time. So very different picture here. You look at ChatGPT, for example, that is trained with over 4 billion data sources out there, very different than what a typical rule-based chatbot can handle. So there's a lot out there, right? I know a lot of us are mostly using ChatGPT version 4 at this point, or 5, but there are a lot of differences between these products out there. Gemini is the Microsoft version, MedPalm 2, which is really built for healthcare providers. That's also a Microsoft product as well. Hasn't been fully rolled out yet. Claude for developers, Mistral, and of course ChatGPT. These are all, what are the differences? You'll see it right there. Differences in that training data, what they have licensed. MedPalm 2 has licensed more clinical guidelines than ChatGPT. Domains of focus, interface capabilities. That is really what differentiates these systems, these large language models from one another. All right, so we will shift gears now to a little bit more specifics of how AI is evolving and growing in healthcare and how we can prepare for its growth as well. So, the promise of artificial intelligence is essentially this. You have your healthcare practitioner, whether, physicians, pharmacists, nurses, what have you, and you add artificial intelligence, give them those capabilities, and you're resulting in improved patient care. That is our goal. I will tell you the goal is not to cut staff. The goal is not to see more patients. And ultimately we have to have a mentality when we're developing these artificial systems that we're not replacing these people, we're working with them to reduce these mundane tasks and boost efficiency, boost productivity, make us more lean, and shift our focus. Many of us know in pharmacy and other forms of healthcare that there are a lot of time sinks in our professions. All these forms of paperwork, of documentation and billing and what have you, these systems can easily be transitioned to forms of artificial intelligence to take over a lot of these tasks. So really, we should always make sure that the ultimate goal is to improve patient care, that we're sitting down with the patient more face to face. We don't have to worry about, taking mundane notes, billing later. And a lot of the clinicians that I talked to mentioned this, what AI has already done for them. And we'll talk about one example that's already been done at USC, where it's a form of artificial intelligence called ambient listening. So for example, and many of you have probably seen this already, is you're sitting talking with the patient, you have your phone next to you, it's recording the conversation, and it is transcribing your note for you, right? It's not just copying word for word, but it's itemizing the problem list one by one. And this has actually been rolled out already in our clinics. I'm using it myself as well. And it's come a long way. And also responding to patient messages. You have a patient that's saying, okay, I'm having these symptoms, and the artificial intelligence will prompt out an answer for you that thinks it's fit, you approve it, and you send it to the patient, right? And what is this doing in turn? It's decreasing the cognitive load for a lot of these providers, right? And some providers call, when you go home, we often know that the work is not done. We're still thinking about what we did throughout the day, having to catch up on things that we missed and we didn't have time for. So some consider it to be more pajama time. So we're thinking this, you go home, you start working on your notes, you have to catch up on all of these things, but this can cut a lot of those mundane tasks and then support, the burnout that a lot of these clinicians often face. And this is just one example out of many, as you can see here. So, you look at the background in terms of where there are potential applications of artificial intelligence in healthcare. We've given the example of radiologists, and I'll tell you, actually, you might be thinking, oh, radiologists, you probably won't see much of them anymore, probably no more residencies there because they're going to be all taken over. On the contrary, radiologists are advocating for this. They want to see more AI to make sure they're catching these things that they often can miss from the human eye. And so you see that response there, risk assessments, personalized medicine, a lot of our precision medicine that we're seeing, especially on oncology, AI can help us make sure we're capturing those, any targetable mutation that we're addressing. Clinical decision support, that's an area that I'm going to be focusing on extensively. And lastly, one of the things I will chat about is the operational efficiency. And when you look at what you can do in healthcare in terms of what areas you can have AI work in, I typically, split it up into different sections. One, you have to think of what's the risk. Is this patient facing? Is this making treatment decisions or not? And the impact, how wide is the impact going to be in terms of how many providers this affects, how many folks in the health system this will have to understand this form of AI. And there are more low risk things, especially focusing on operational efficiency, administrative tasks, scheduling, resource allocation, patient flow, EHR, revenue cycle, searching on EHRs, reporting errors. These are all things that are considered, for the most part, low risk that can easily be worked on first as we start rolling out artificial intelligence in our health systems. The clinical software out there will take more testing, certainly. So here's the golden question. Will AI replace me? I mean, every talk, this often always comes up. And I will tell you, when I was first deciding on whether to go to pharmacy school or not, I was worried about automation at that time. And does anyone know why I put this picture over here? Any thoughts? So that is a robot that's filling prescription medications. And at the time when this was coming out, everyone was freaking out that this is going to take everyone's job and there's going to be no need for pharmacy anymore. Just robots filling things and being sent out. And so I'll tell you what happened is not that. And one of the things that was true, in fact, is that we started preferring technicians that understood how to use these robots versus technicians that did not. And I think it's going to be the same thing with pharmacists eventually. Our goal will eventually not be getting rid of pharmacists, but preferring pharmacists that understand AI over the ones that do not. And so certainly I think that's the future direction that we're heading in for AI. So I don't know if anyone listens to podcasts, but I often do, whether it's a drive home or what have you. And one of the podcasts that I often listen to that talks about AI is the New England Journal of Medicine AI podcast. And I listened to this podcast by Dr. Adam Rodden, who talks about something called the magic donut. And he essentially says this. He says, I use CT scans all the time. And to me, what a CT scan is, I put a patient in this magic donut, and then I get this really cool image that comes out, and it helps me take care of the patient. I don't know the physics that goes on in terms of coming up with this image. I don't know the intricacies of it, but I know it helps me take better care of my patients. And it's going to be a similar concept where it comes to AI eventually, right? We don't have to always understand exactly how it works, even though it does help. But I think with time comes comfort with these different softwares. And you think back also, 1800s, when you look at hematocrit, when we pull a patient's hematocrit, you'd pull their blood, shake it, you see how quickly things fall, and the hematocrit level is generated there. Now we send the lab out. Does anyone know how they measure hematocrit in the lab? Very different now. And so we start trusting these systems in place. And so that form of trust is going to be incredibly important as we start incorporating more artificial intelligence into our practice. So here's a question. So, a lot of us have heard that there's AI that's going to be, starting to take hold in different practices. And one of the questions that comes up often is AI as good as a physician? And so you'll look at, ChatGPT, it's passing these exams. So pass the USMLE step 1, step 2, step 3, and you look at GPT-4, and this is kind of a comparison versus physicians that take these different specialty exams, and ChatGPT-4 is that lighter green color. And you can see the AI is even passing a lot of these board exams, except for OB-GYN. But for the most part, we're ChatGPT-5 at this point, by the way, that, it is passing and it's doing well. This is an important, point to discuss as well. Diagnosis of rare diseases. The human mind can only grasp so much knowledge, right? There's no way everyone's going to know their own specialty, every other specialty, and all these rare diseases as well. So we're certainly going to have to rely on these systems to take care of these patients. So here's a study that took place that compared physicians to ChatGPT-4 and 3.5. You see ChatGPT-4 is those red lines on the top, physicians are those green lines. You see percentage of the diagnosing the rare diseases correctly. Certainly, artificial intelligence is doing a much better job in that setting. So there are a lot of vendors out there, right? You look at the different, vendors that are coming out. There are many that are in production. There's a lot of corporate greed that is going on right now. I do want to share some of the big ones that are out there right now. So Clinical Key, large language models specifically for Elsevier the publications. So it's obviously its own system. These publications are licensed through their open access for their own AI. So it's using its own database trained on its own forms of publications to provide clinical decision support tools for physicians and pharmacists and other staff. Patient First, FDB First Bank, alert reduction for community pharmacies. Epic has actually been doing a great job in incorporating forms of AI, outcomes prevention, HPI summaries. I think this was what I was most, looking forward to with AI. When you have a patient that's transferred in terms of their care to you, you receive, a packet like this big of all their past medical history. There's no way you can sit down, go through each page and understand, understand the full picture. No one has time for that. So the idea here is I was very excited about the summary features of the HPI summary feature of Epic that they're working on, outcomes prevention tools, big stuff going on there. Ambient listening, we talked about. Open evidence, also licenses a lot of databases out there, different publications. Also, many of us are very familiar with at this point, Surescripts, dealing with prior authorizations, and we'll talk about that as well. So clinical decision support systems. So this is where you're working inpatient, outpatient, what have you, and then you get an alert all of a sudden saying, hey, there's a drug interaction here, or oh, this weight might not be correct. And so we've incorporated clinical decision support systems since the early 1990s, and it's been fantastic. Better quality of cares, less errors, adverse effects, and efficiency for us all. But there are disadvantages. These are mostly rule-based systems that come, that are presented to us. And oftentimes, a lot of you, I'm sure, are very familiar that these alerts often make no sense, and they're just ones that we easily skip. In fact, we have huge committees actually at USC where we try to tackle alert fatigue, where we say, is this alert actually feasible? And they've done great work, but I'll tell you that there's still a lot of work to be done, because I would say 95% of the alerts I get are really not actionable at all and do not impact decisions for me at all. So you'll get these, lack of conceptualized information, constant alert fatigue. It's more of a rule-based shotgun approach where you're sending out all these alerts. Patients on, methotrexate, for example, for us, it thinks that the rheumatoid arthritis dose is the same as the cancer dose. And so it freaks out every time we're verifying a methotrexate for a cancer patient. You just have to constantly skip through them. And so that's one of the challenges that is faced there. But what's to come? And this has actually been starting since, the past few years. And I will say this is a very high risk AI system. So it's going to require more testing to be done. But you'll see advantages there. Improved accuracy, reduced alert fatigue, predicting patient outcomes, personalizing medicine using the context. So it will tell that I have a cancer patient, and it won't hound me about why am I using a methotrexate dose over 10 milligrams, where I typically use 10 grams for cancer patients, right? And so that is certainly a huge advantage, but there are certainly disadvantages. The implementation costs, ethical concern about sharing data with these companies, brittleness, and we'll talk about hallucinations for these platforms as well, important topic. There are a lot of studies out there that talk about these clinical decision support systems and kind of compare them to the status quo. You'll notice here, for the most part, you look at, for example, drug interactions. When you roll these systems out, it actually reduces the prescribing of these interactions by about 12% compared to our typical decision support tools, where we often just skip or ignore. Antimicrobial stewardship, appropriate antimicrobial selection for AI models, 90.4% versus clinician 88.1%. Recognizing when we should use anticoagulation appropriately, AI model does better. Predicting organ dysfunction, right? So it's not only the creatinine that it's looking for that weight increase ahead of time, right? the decreased urine output. It's predicting these things with nephrotoxic medications going on at the same time. The AI system does better. So there's this interesting report that was released from McKinsey that kind of outlines the current climate of AI use in different health systems. So you have your payer end, your health systems end, and kind of different technology groups as well. You'll see areas that are being worked on in terms of AI, what roles are out there. So administrative efficiency is the big one. We talked about a lot of those examples, everything from just scheduling, billing, what have you. Clinical productivity is those ambient listenings for the most part. I think that's the most common. And a lot of these other areas that have been worked on as well, the quality of care, patient satisfaction and engagement. And what you see here on the bottom is that for the most part, as what we're seeing for these institutions, as you're including these AI systems, you're seeing improved efficiency, fewer diagnostic errors, fewer reduced hospitalization readmissions, optimizing workforce allocations, and that does result in certainly savings. And so here are just percentages of who's starting to use this. And for the most part, overall, you can see 85% of folks, these systems are already starting to implement AI or are pursuing implementing AI systems in their practice also. And you can see kind of the breakdown between the different types over there. All right, so healthcare workforce shortages. And so I do think this is an area that AI can help us with. And we do often talk about burnout, which is an extremely important topic to discuss and be open about. And so certainly there are expectations, and this is from the National Center of Health Workforce Analysis, that does expect shortages across the board in many different healthcare providers. And I do think that AI can certainly bridge some of these gaps to free our time from these mundane tasks to focus on more quality patient care. And so that's something that I'm looking forward to. And so here's a fun little example. So I have the utmost pleasure of dealing with insurance companies and trying to get approvals of different agents out there. And so we had a patient with something called graft versus host disease, where we wanted to use this newly FDA-approved treatment option for them called axatilimab. And it was actually originally denied by the payer. And I got the payer kind of packet of the denial form, and I actually uploaded it, redacted the patient information, uploaded it to AI, and put this little kind of prompt. And the more you prompt the AI, the better it typically does, right? And I said, write me this appeal letter, and wrote me this beautiful appeal letter. And I will tell you that not a lot of folks are using this yet. And for the most part, if you send this appeal letter to a payer, they're like, wow, this guy spent so much time writing this wonderful appeal letter. There's no way, there's not even a grammatical error on here anywhere. There's no way I can deny him. But I tell you, they're starting to see this more and more. But this has been helping a lot. And there are AI, before this I was writing these by hand before. It'd probably take me, 45 minutes, an hour. Now this whole process is like 5 minutes or so. So that helps with operational efficiency. There are many different platforms that are working on artificial intelligence now that specifically dealing with authorizations, right? Humana Health, for example. And we're looking at different vendors as well for this. And the basic idea, and in order for this to be successful, you have to have both parties, the healthcare facilities and the payer, be okay with these AI systems. So you have, it's called fax, both sides of the fax communication using AI in both of these settings. So the basic idea is we're using AI to pull relevant information that the payer would like to see, what they've tried and failed, what line they're using this therapy in, and we'll send over those, those notes, those summaries. And at the same time, we also know what that payer is looking for. We have hundreds of different payers, and every payer often has different criteria for use, right? And so there's no way one person can remember, oh, this payer, Anthem likes this, Scan likes that. So these AIs, they have no problem with remembering all of that. So you're having these systems in place to kind of share that information. And on the receiving end, they're receiving I send them, the more the merrier, in my opinion. I send them everything. But they're not going to go through 80 pages of notes. This will summarize things for them, pull key information that they're looking for. And the idea is at the end, a human will decide whether or not they will deny or approve the medication. That's the concept of that. Is called human in the loop. It's not autonomous AI on its own. Human in the loop, you have someone at the end making the final decision for these cases. Many different examples out there. Here's a study that looked at, type 1 diabetes patients on a pump, randomized to AI management versus clinician management. And it was non-inferior to clinician management in terms of time to serum glucose range, to target serum glucose range and readings below 54. Breast cancer diagnosis, using AI in form of vision to guide us, right? And so better in diagnostic performance than radiologists without AI, more sensitive and better at detecting those early forms of cancer that are seen. And then AI is even more, besides the quality, it's much more empathetic than we are, right? And so, if I'm sitting at home after a long day and I'm responding to a patient message, I will probably not be incredibly friendly, right? But the chatbot is always nice. It's always very friendly. And so, these are some of the things that are often looked at. All right. So, last two sections that we have here, one is AI use in pharmacy practice. So we saw that AI is stronger than many physicians in terms of practice, but how does it compare to pharmacists? Can you get a pharmacist degree? And the answer is yes, in terms of just the examination portion. And so ChatGPT-4 passing the NAPLEX exam at answering 87.1% of questions correctly, right? So, that's the scale there. And one of the things that's often looked at is where can we go as pharmacists are being more, using AI more, and then look forward in the next 5-10 years, where are we going to end up being if we start using AI? And this is the current climate right now, where pharmacists are spending majority of their time. Retail, clinical. See, a majority is verification, charting, right? In ambulatory care, what are we doing mostly? Chart reviews, also verifying mostly for hospital pharmacists as well. And here's where we could be with AI, focusing our time more on patient education, reporting, drug information, counseling. Our time can be shifted to more patient-focusing aspects. And if provider status for pharmacists was important before, in my opinion, it's even more important now as we dive deep into the realm of artificial intelligence. Here are just different examples out there of how it can impact pharmacy. The first two, oftentimes, those are often rule-based, and we already have a lot of these embedded into our systems. But everything from predicting drug shortages, predicting inventory that should be ordered with time, seasonality of these meds, 340B compliance are things that can, take hold in inventory management. Verification, right? So it's always, AI can tell you, what, the patient's renal function is a little bit off. Here's the dose I will recommend instead. That would be wonderful, right? Or, what, the patient had this penicillin reaction. It didn't seem very severe, and it looks like they've received a penicillin since then. I'd recommend proceeding. That would be very nice, right? And so the future really entails potentially some systems with heavy testing, approving orders that meet certain criteria, right? And one of the challenges that we're often facing is duplicate orders. I'll tell you, the Joint Commission is often looking at this tremendously. Duplicate orders. You have, multiple antiemetics or multiple pain meds. You have a morphine that says give for moderate pain, another one you're given also for moderate pain. Which one do you give first? And these are things that can be easily caught by AI systems. And here's just some clinical aspects: stroke, sepsis. I will tell you, it's not a good idea for you all to ask ChatGPT to come up with a CHADS score or QSOFA criteria. ChatGPT would not work for that. I know people try to use that, but it would not. But you would have to come up with systems in place that are capable of doing that. And there certainly could be. Precision medicine, we've talked about. Precepting. I will tell you, I have students that I'm currently precepting in the back, and one of them told me the other day, "You're my only preceptor that has ever told me that I could use AI when I'm coming up with an answer." No, has anyone else told you to use AI somehow? Okay. And I think, we have to start. I mean, you're going to use it regardless, whether I say it or not. But I think I want to make sure you're using AI responsibly, right? Is not completely relying it as a sole source of truth, which I often see happening, but using it responsibly is important. Research, another area that it can grow tremendously. We're getting these 200-page protocols. We need summaries. This could help. So AI ethics, as we start closing off today and go into vendor evaluation, as I mentioned, there is tremendous greed in this area, and we have the responsibility to get it right. And there are ethical concerns here. Data privacy, certainly one of them. Not inputting patient identifiable information. As we know, these AI systems will take the data and start learning from that data. So we don't want to share those informations. Hallucinations we'll talk about. Liability. Liability if you're giving an answer correctly or incorrectly. Or eventually, I think there's going to be court cases that say, why did you not use AI? Right? You made this mistake. Why are you not using a system that could easily catch that? I think one day that will be there. And equitability. And affordable. Is it affordable? I don't want one institution that has access and one across the street that does not. Cost is going to be an important factor as we start growing these different models. And so here's just one example as we talk about AI ethics. I had a patient, I don't know who that guy is, but this is an AI image. But I will tell you, I had a patient the other day that was diagnosed with a blood cancer, CML. And we're talking about treatment options. And he told me, well, ChatGPT told him he can just take some vitamin C and some ginseng to treat it. And that's probably what he was going to do. He doesn't want to take any of the other medications. And ChatGPT, and he showed me what ChatGPT said he had his phone. And I will tell you, ChatGPT made a convincing argument. It's like, no, it was like, you don't need those pills. Just take some vitamin C instead. So the problem is ChatGPT will tell you what you want to hear based on your prompt. If you ask it, is it better if I take vitamin C versus these other chemos? Oftentimes, and it depends on the quality of the AI version, it will probably come up with a convincing reason why you should not. And if I rephrase the question to why is this better than vitamin C, it will give you an even more compelling reason why you should. So these are certainly difficult conversations that can take place in our practice settings. And so hallucinations, and many of you have probably heard about this topic. You get these wrong answers that come up, or like, how did AI come up with this answer? And the answer is, AI is not inherently trying to be wrong. It's, again, predicting the most likely answer. It doesn't know the truth. It's just using its algorithms to come up with potential answers, trying to fill in the gaps. And so I will share with you one example. So not this block, but students in the last block shared with me, I asked them about PEG asparaginase and how it's dosed in this regimen. And they told me it was given on day 4 and 18. I was like, okay, so where did you find that? And they told me found it on ChatGPT, which again is not the right answer to give. But just for your reference, it is not given on day 18. It's only given on day 4. And so you can certainly see it probably pulled up, and by the way, Reddit is one of the resources that ChatGPT uses. Probably pulled it up from somewhere, just grabbed it, saw 18 somewhere, and pulled that information in. So it is not always this, you have to fact check your answers, but it could certainly assist you, right? That's incredibly important. You cannot go in front of a judge and say, you know what, Your Honor, I did give the patient 300 units of insulin, but ChatGPT told me that. So, it's not my fault. If the error is made using, AI, that error is inherently your error, right? So you have the responsibility for your final answers. You're signing off on these things. that is your responsibility. And so these are just some limitations, and we have to understand these limitations tremendously. And I will share with you, a lot of institutions are coming out with policies, procedures of when or when not to use AI. Some institutions block ChatGPT from even being accessed at their sites, and some have even made their own large language models. For example, there's one called Stanford GPT, right? Just to make sure it's HIPAA compliant, that the data is not shared outside. And so you do certainly have to be cautious there. And these are the last few slides here. So vendor evaluation. We mentioned the corporate greed. We have the responsibility to pick products that we think will work well in our health system. And I will tell you, there are many different options out there. And I don't think we're going to get to the healthcare of tomorrow if you have to have 40 different vendors take care of your AI systems. I'm hoping they'll start consolidating as we expand. And so, this recent study that was in Nature Medicine found that only 4% of AI health tools were authorized and had undergone validation in randomized controlled trials. And I would be the first one to argue that AI tools should be vetted as extensively as prescription drugs. Randomized controlled trials, especially, the patient-facing ones for sure, should be vetted extensively, right? And we know that that's not often the case. So when we're evaluating these vendors, we need to ask about these points. And so you will notice, this is kind of a document from UCSF in terms of their vendor evaluation. We talked about, how extensive do you have to really gauge these vendors, and it will depend on the risk and impact of these different models out there. You have to ask certain questions. Is this better than our current standard, right? Is there data that compares it? Are there RCTs? What is the form of validation they've done? Is it safe in my patient population? Questions to also ask is the integration and support, right? How easy is it to integrate into Epic or Cerner? What is the training that's required? What is the support systems that are going to be in place? Cost of implementation, return on investment is an important concept as well. These are often very expensive. What is going to be the return there? Contract considerations. Do we have a clause in place that says you cannot use our data to train your AI systems? These are subtle things that make a difference as we start seeing more and more of these vendors start approaching us trying to sell us on their AI products. And as I mentioned, I think for the most part, the current need right now is often those administrative tasks. And I think the long-term goal, the vision that's in place should ultimately be that we have high quality healthcare available around the globe at everyone's fingertips to really provide 24/7 high quality care for these patients. I think that's the goal, and I think it is in reach. These systems are growing exponentially. AI systems are growing exponentially, right? If you remember when ChatGPT first came out in 2023, it is very different than what it can do now. And that growth and that potential will only continue to grow as more of us use it, as it's trained on more and more data, the algorithms start improving. And so that's, certainly a consideration to make. Here's the final slide here before we go to the questions. We definitely talked about a lot of different things today. And I hope it was helpful to understand, everything from how AI works to its potential in healthcare is extremely important to understand, especially in your training, is to understand how it will impact you in your future careers, because I guarantee you it will at one point or another. And we should use these technologies to improve our patient care. Utmost important thing, to improve our patient care, make us more lean, productive, is also important. And, we mentioned the responsibility that we have in place. And the last point I want to share with you all today is a call to action where, in our positions, whether we're clinicians, whether we're researchers, we are the closest people to understanding the problems that are going on in healthcare. So look around for those problems and ways that we can solve them, ways that we can partner with these companies to improve healthcare is going to be tremendously important. So that is all I have for you today. I will share that Ejin, where are you? PGY2 resident in oncology is actually going to be presenting this topic, the same one. So if you want to get another version or if some of your colleagues missed it, he'll be at CSHP this year presenting this on Halloween night. So I know you all don't have anything better to do than listen to it. Yeah, but it'll be a great presentation that he'll be giving at CSHP. So let's go quickly through some questions and we'll leave the last few minutes for some Q&A. All right. So first question that we have here is which statement best captures how AI differs from traditional rule-based systems in pharmacy? Any thoughts? Okay, heard it. B. AI learns patterns from examples and adapts to new information, right? Regarding validation of AI tools with regulatory authorization, what did the Nature Medicine article highlight? A. Right? And lastly, which action best aligns with the policy and ethics guidance presented for clinical use of AI outputs? C. That's right. So again, I hope this was helpful as you launch your careers. I know there's going to be more CEs coming up, and I'm very excited to hear all of your presentations for the residents coming along. We have a few minutes left. If there's any questions, I'm happy to address them. And also in the Zoom, the folks on Zoom, I will also monitor the chat if there are any questions from there as well. All right, if not, have the nice rest of your day and we'll chat soon. Thank you, everybody.
Thank you. The chat's blowing up. Thank you.